This past week, many health organizations honored World Stroke Day.
University Hospital right here in San Antonio serves as a comprehensive stroke center, so we reached out to one of their neurologists to learn a little more about this medical emergency.
Now, we found out exactly what a stroke is, how it can be prevented, and how it can be treated.
Stroke is actually a very common condition and is mostly due to a blockage in one artery. It's very common and can be both prevented and treated. The conditions that usually lead to stroke are, in our community, high blood pressure, diabetes, and high cholesterol. Most of the symptoms you're going to have, we usually summarize with the acronym called FAST. So you get drooping of the face, you can get weakness in one arm, you can get changes in your speech, and what is very important, T stands for time. So the sooner, once you recognize the symptom, you need to, act fast and come to the hospital as soon as possible. In our population here in San Antonio, control the blood pressure is one of the biggest, the biggest thing you can do in order to prevent strokes. Diabetes is also, the better you control the diabetes, the most likely you're going to avoid strokes. High cholesterol is also a big factor for strokes, and irregular heart rhythms, also known as atrial fibrillation, also needs to be treated to prevent strokes. Well, certainly, a diet, exercise regularly are important factors, to prevent strokes. Diet, particularly the Mediterranean diet, is one of the diets that has shown that prevents strokes.